Thank you so much. And welcome. Happy Thursday. It's so nice to see you all. My name is Rhonda Alexander, and I am so excited to welcome you to the Networks of Opportunity for Child Wellbeing 2021 webinar series, where today we'll be focusing on sustaining family-led innovations for equitable COVID recovery. So I'm just going to spend a couple of minutes on some housekeeping and getting us started, because we have a wonderful panel of guests to hear from and speak to today. So our session outline, we're going to spend a little bit of time right now on our welcome and overview. I'll tell you a little bit about Vital Village Networks, and then we'll jump into our conversations focused on sustaining family-led innovations for equitable COVID recovery. And then there will be time for panel discussion, as well as questions and answer sessions with the audience. And then we'll wrap up right at 2 o'clock Eastern. As Manuel shared, you should be able to see the globe on your navigation bar, so you can select the language. So if you have not already selected the language of your heart, or the language that's best for you to communicate, please go ahead and do that now. As Manuel also mentioned, our Spanish language access is being provided through the Community Language Co-op based in Denver, Colorado. We will be recording today's session. We are recording today's session, and slides and the recording will be available on the Now Forum as soon as possible, which can be found at networksofopportunity.org. I invite you to submit questions through the Q&A icon on your dashboard. I'll show you what that looks like in just a minute. And you can also use the chat box to comment. I know we're doing this webinar style, but we'd still love to hear from you throughout our time together today. Again, here's a quick little hint of where you can find that Q&A button. And just a little bit more, if this is about us, if this is your first time joining our webinar series, I want to just share a little bit about Vital Village Networks. We are a national collective of diverse change makers and organizations seriously committed to pioneering sustainable approaches for transforming child, family, and community well-being. The Networks of Opportunity for Child Wellbeing, also known as NOW, is a national initiative that's powered by Vital Village Networks, and we exist to achieve social transformation and racial justice by partnering with individuals, organizations, institutions, coalitions, etc., to build capacity focused on equitably sharing power, so that communities can really lead and grow their own transformation. Just a quick hint on our guiding principles. We are focused on belonging. So we're centered on dignity and equity, learning together, recognizing that those closest to the challenge are the ones that are closest to the solutions, engaging so that we are designing with and partnering with one another, and not trying to fix or design for, and all of that leading to transformation, where we can identify and frame our challenges so that we can address them collectively. So it's a little bit about Vital Village Networks. And you can learn more on our Now Innovation Forum, where you can share stories, hear stories, find resources, and connect with us. So I invite you to join us there at networksofopportunity.org. So I want to make sure that we have some time to get into this amazing panel today. We have the pleasure of hearing from Jametta Lilly, who's the Chief Executive Officer of the Detroit Parent Network. We will also hear from Ms. Rose Grillier, who is a board member and co-president emeritus of Community Organizing and Family Issues, known as COFI, as well as Liliana Olayu, are also co-president of Community Organizing and Family Issues, so COFI. So we'll first hear from Jametta, and then we'll turn it over to Ms. Rose and Liliana, and then after that we'll go ahead and open it up for questions. So I'm going to stop my screen share and welcome Ms. Jametta Lilly, so that we can hear from her.
Well, first off, I cannot tell you how thrilled I am. Thank you, Rhonda, and how blessed I am to be part of what I hope will be a conversation. So first, I'd like to share that my name is Jametta Lilly, and I am extraordinarily blessed because I serve as the CEO of the Detroit Parent Network. And I'd like to share with you some things about the Detroit Parent Network that has been in a Detroit institution for almost 20 years. And so I'd like to tell you a little bit about DPN and also how we've had to pivot, like all of you, from being a place-based and multi-place-based organization to having to cope with what we're all in right now, which is this digital world. I see heads nodding. So we've also had to become digital warriors because we've always been addressing the issues of the digital divide. So I'd like to tell you a little bit about DPN, how we have tried to listen, engage our parents, and pivot our programming in partnership with others to do the work of what we like to call stomping COVID, and stopping COVID as a collective, because this disease, this pandemic has, as we all know, devastated, in particular, African American, indigenous people, Latinx, and millions of people throughout the world. So I'd like to share with you a little bit about DPN and then really go into a conversation about what we've tried to do in terms of how we move forward. So the Detroit Parent Network is what we like to say, we are shining our light through the pandemic. We have been in existence for about 20 years, and our focus has always been to educate, to equip, and to empower parents as champions for their children, but not only just being champions for children, which is so important, but also being champions for change. And we've done that we do that through our training. We do it through 4 levels of training with a great deal of focus on advocacy and leadership, and also specialized programming. And so important that the COVID dynamic has taught us is family support, because we know how all of us have been struggling around the issue of spiritually, emotionally, psychologically, grief, and all the things that COVID has put on us. So in addition to always doing our traditional focus, which is powering up our parents to be what they are, which is that parents are the first teacher for our children, and they're also the most enduring teacher, and therefore they can be a champion not only for their child, but for all of our children. So we've been doing this work, as I said, training, support, and specialized programming, with a great deal of focus on our early literacy and college to career culture building. But we recognize that when March came about in 2020, we had to do a pivot. And we've always known that our community cannot thrive. Our families cannot thrive if we are not healthy. So I've had the blessing working with a really strong board, a fantastic Detroit Parent Network team, to try to bring in some of the background that I've had for decades working in maternal child health and primary care, public health, and also mental health. And switches to more of a lens on community health and wellness. Because as we know with COVID, the health disparities that have been there that are long-term as a result of structural and systemic racism, and also as the result of the behaviors, unfortunately, that those systems have created in our communities, we know that African Americans in particular are particularly, again, more vulnerable in terms of our health disparities, and how that is absolutely linked to what's happened with COVID, as well as with the educational outcomes that we see. So we have been focusing in on, as we do everything, parent, family, parent, family. And we think of families because we are not a 2-gen organization. We rock it, as I like to say, with all generations, so that we are working with families to grandparents, and yes, to Uncle Joe, who lives next door, that no one knows how we are really related, except we love and support our families. So some of the ways that we have moved forward, if I can show you in the screen, you'll see something that says Tech Light Force. We are realizing when March 20 came about, we took about 2 months of just hitting pause, like the rest of us, trying to figure out where are we. We called hundreds of our parents that have been part of the Detroit Parent Network. We talked to our partner organizations who were trying to figure out how best to navigate something that was very unclear and very foggy, both obviously at the national level, but certainly even locally. However, in this process for us, we heard several things. One, parents were trying to figure out, well, now that the schools are saying that children have to live at home and live and learn at home, what does that mean in terms of what do I need to do to learn how to parent at home on Zoom, on Ring Central, on webinars, and all the things that most of us, and certainly most of our parents, professional as well as community-based parents, because we serve everyone. Our parents have lots of initials behind their name: super mom, super dad, super grandma, uh, JDs, PhDs, because everyone that has been engaged as parents is welcome to DPM. So our parents were saying they needed help addressing what we know has historically been the digital divide. And so we try to do that from a different level. And that was that we started our Tech Light, which is a opportunity that we have one of our young youth ambassadors. We provide training to families, both the parents, we even have a grandparents group that is specifically, we tell them, okay, take out your phone. Let me show you how to use your phone so that you can talk to your grandparents, how you can do telehealth with your therapist, with your doctors, and so importantly, how you can be an advocate to make sure that you can have the appropriate bandwidth and things like that that are necessary for all of us to stay connected. So that was one of the ways from an educational standpoint that we moved forward. We also, in talking to our families, not only were they struggling within, not so much as we move forward with the American Rescue Act, but we also were hearing from families what we already knew, which is that too many of our children are not reading at grade level proficiency. And the Detroit Parent Network, Education Trust, Skillman Foundation, Kellogg Foundation, we have been focused on building up parents' understanding of how important literacy is. So we created a program called ALLO, which is Advancing Literacy Online Enrichment, in which we have our parents, because we train our parents to train other parents. And we're helping parents navigate not only the Zoom world, but also how to help their children discover, and for the parents to discover how to create a environment at home that is enriching, that will enable them to now not only thrive in terms of knowing how to use the internet, strategies of how to do online learning, and really importantly, how parents can make sure that their child and their children, in fact, their whole family, have a literacy rich environment. And I just kind of want to hit pause on a point, and that is to say that we have to make sure that our families are healthy and that they're educated and that we're exposing them to science, because we've seen what the result is when people do not understand the information that we're seeing about COVID or about vaccines. So real quickly, I want to take you into what has been a really novel approach that I believe that we've done. So not only addressing the digital divide with our families, creating opportunities to strengthen partnerships with schools, with parents, and with children, trying to cope with functioning at home with online learning, which is huge because we know there is a huge learning loss that has occurred. Unfinished learning is the term that we like to use. But in this process, very early in COVID, we determined that we needed to show up when it came to helping our community with the devastating impacts of COVID. So we took a model that I had the blessing to have developed some time ago with our partners, and we trained up our parents to be community navigators. And they work right alongside of the mobile COVID 313 mobile units that have been doing testing and now vaccines throughout the city. So let me share a little bit more with you about that. So we really have been trying to be focused on being impactful, being innovative, being intentional, even in the midst of the pandemic. And for anybody that's out there, you recognize that when it comes to what's happened to nonprofits, as I said, we're an institution, we are a nonprofit organization, which means that in the role that I have to do is also be concerned about our funding, our sustainability, and at the same time, making sure that we are relevant and responsive to our families. So I gave you a little bit of what we were doing at the parent specific level, but DPN also shows up as a thought leader trying to work with different partners to advance equity, to advance that parents must be part. Parents, no matter where you are, whether you're in Chicago, Kofi, whether you're in Louisiana or wherever you are, parents must be part of the redesign and co-design of the kind of equitable society that we want for our children. So as a thought leader, one of the things that happened really early in March of last year, several organizations, in fact, it was about 30, came together to say, what can we do to make sure that our families are hearing information that is tailored to their levels of understanding and direct needs. I don't mind saying, and I don't mind bragging, that Michigan is extraordinarily blessed with really highly competent, caring, committed leadership. From our governor, Gretchen Whitmer, to our phenomenal Lieutenant Governor, Garland Gilchrist, an African-American, as you can see in the middle of this slide. And also our Chief Executive for the state in terms of health is Dr. Jonae Caldoun. So we had this awesome threesome that was doing all of these wonderful press releases and et cetera. But let me just go there. The reality is in the neighborhood or where moms and dads and grandparents are trying to struggle, they're not watching the TV station for what the governor is saying, even though what she and Dr. Jonae is saying is the information that we need. So we took it upon ourselves, and out of that effort came the COVID 313 Community Coalition for Families and Youth. And for more than a year, starting about the third week of March, we started creating these town halls focused on health, education, basic needs, and social justice. And working with Detroit Public TV as our communication partners, which is a PBS entity, we're really so pleased that we have reached over 300,000 people since last March. And we continue to do these weekly town halls, literally off the side of our desk, because we weren't funded to do this, but organizations came together to say, how can we make sure that our parents and our community hear this information consistently? We also showed up, and I had the honor of being appointed to Governor Whitmer's Coronavirus Racial Disparities Task Force. Michigan declared very early in the pandemic that racism is a public health tragedy. It is an emergency. And so a task force was created. Our Lieutenant Governor was part of that. And Detroit Parent Network, as one of many Detroit and statewide community-based organizations, has been working on informing the governor, the state office of community health about the systemic issues, because we want to make sure that we are addressing the issues of structural racism. And of course, DPN was adding our voice to that conversation. We also have been engaged in working with Education Trust, and some of you in the community know their work about really advancing equity in financing, equity in quality and effective services. So we've been doing all this kind of work as thought leaders, at the same time working at that grassroots level, holding the hand, supporting, and being in the neighborhoods. And in this slide, which I know is a lot going on in this slide, but I want to lift up a couple things. So in our community coalition work, at that top level, you'll see we have all types of people that are part of the work. I'm delighted to partner with an awesome equity warrior, Angela Reyes, who is the executive director of the Detroit Hispanic Development Corporation. Bernita Bradley, who is one of our awesome parents, also happens to be on the Detroit Parent Network board and is part of our citywide effort of Hope Starts Here. You see Governor Stabenow, and you also see too in the far corner Dr. Mariana Eccles Daniels, who is part of the Kellogg Foundation and has been very much a partner to ensure that community-based organizations have the resources that they need to do this work. And like everyone else, with George Floyd, with our brother George Floyd, with Breonna Taylor, and the dozens and dozens of people that have been adversely impacted by police brutality, we raised our voices. And we've been engaged very deeply on addressing the issues of social justice, police brutality, and how do we change. The last two things I want to kind of share with you have been a little fun. I think you saw that slide. We talked about being innovative. Well, you know, it's one thing to say that we need to have trusted voices because the messenger matters. The messenger matters. So in the middle of COVID, and now that we have vaccines, we know the city of Detroit and many other communities throughout the nation have not embraced vaccines at the rate that some of us may have thought, but certainly not as needed. And we already know that there is every reason, in particular, for Black communities to be wary of medicine and the health industry. Our history is very real. Not only is our history real, but we also know that to this day, implicit bias and systemic racism still exist in the system. However, when we talk about these vaccines, we realize that this has been an international effort. We know that there have been Black scientists and African-American scientists in the development of the vaccine. So what Detroit Parent Network has done is we've created what we call Healthy Parent Cafes. And we invite the community to be part of this online conversation with trusted, notice I use that word, trusted leaders in health to have conversations. And we've done this in different ways. We've had healthy elders talk directly to primary care physicians. In this particular slide, we had a delightful segment where we had not only pediatricians as the trusted health experts, but we had families and we had children. Anywhere from, in this wonderful picture here, I don't mind bragging again, one of our awesome team members, Jasmine Criswell, who's been so much a part of our health focus. So we had children as young as 2 and 3 and 4 and up to 18 years old asking questions directly to the pediatricians. What is COVID? Why should I get the vaccine? So it's about involving the community directly to make the work happen. And so we do that again through our parent-to-parent training and coaching. So for community-based organizations that have not worked deeply in the community space, it's important to understand we have to invest. We have to invest time. We have to invest our heart. We have to invest best practices and strategies because it takes more to make sure that parents have what they need to not only address the social determinants of health, as well as the economic determinants of education, but what's going on in my household that prevents me from being the awesome parent and the awesome professional that I can become. So we've been doing this work in particular with Wayne State University and with Wayne Health, which is one of the entities amongst many of the really fine educational and health institutions that we are blessed to have in the city of Detroit in the state of Michigan. I want to lift up 2 people in particular in this work. In the center, you see Dr. Haley Thompson, who is from the Carmanos Cancer Institute. And as we like to remind people, COVID doesn't stop cancer. So DPN has been at the table with them about how can we make sure that people who are struggling with cancer or need to have their diagnosis are getting what they need. And so we've been working with them in that realm for almost 2 years. And as a result of that, as a result of developing the family health advocacy work, when the opportunities came for the development of the Wayne Health Mobile Unit that in fact has probably done over 40,000 COVID testing and now thousands of vaccines. Dr. Phil Levy who is not only an ER professional with Wayne State University. He is the vice president for innovation and is the director and the developer of the Wayne Health Mobile Unit that is not only focused on getting shots in the arm, but what we all know is so important is to wrap resources and support to individuals to make sure they get connected to a medical home. And so we've been doing that now. And just lastly, just want to let you know that as a result of this, we are so pleased to share that our family health advocates are now a model, and that we are now going to be working with lots of different partners to make sure that there is a parent-to-parent voice that's connecting people to their medical home, to the resources that they need, and that we're helping families get the online training and support that they need to be able to navigate the fact that we are still in COVID, but also post-COVID. And so I'm happy to obviously, as you can imagine, talk more about where we're going, but I want to hit pause because I am so excited to hear what my colleagues have been sharing as well. Rhonda.
Thank you so much, Jametta. It's so exciting to hear about what's happening at Detroit Parent Network and what you all are doing for children and families there. I'd like to take a moment and just go ahead and turn it over to Ms. Rose Grillier and Liliana Oleyu from Community Organizing and Family Issues, otherwise known as COFI. So excited to have you. So you all will have about the next 15 to 18 minutes to share a little bit more. For those of you who have been commenting in the chat box, I invite you to continue to do that, or also use the Q&A button on your dashboard to go ahead and submit questions, and we will make sure that we leave time for that. So Ms. Rose and Liliana, and we'll turn it over to you.
So everything Jametta said. Good morning, all of you champions of change. My name is Rosalia Grillier, or Miss Rose, whatever you feel most comfortable with. I am blessed to be in the presence of such greatness. Thank you so much, Rhonda. And thank you so much, Vital Villages, for all the amazing work that you guys are constantly doing and how you're engaging others. Now, as an advocate for equity almost everywhere, I wear too many hats to tell you all of them today, so I'll just lift up a few. I am co-president emeritus of Kofi Power Pack Illinois. I'm also a trainer. I'm a board member, co-chair of STOP, which is our Stepping Out of Poverty Committee, only one of our 4 issue campaigns that we work on. In Chicago, I'm at the forefront of the City Clerk and Mayor's Fines and Fees Justice Collaborative, as well as nationally on the CCFFJ, which is the City County's Fines and Fees Justice Reform Cohort. I'm a founding member and governing council member of UPlan, a national entity, United Parents Action Network, as well as several other national entities, NAFSCI, National Association for Family and School Community Engagement, the National Advisory Board, National Funders Group, Partnership with Parents for a Learning Community for funders to treat us as human. And then also I am the lead fellow of CWWG, Closing the Women's Wealth Gap 2021 Fellowship, also known as the Fab Five, and so much more. I won't continue on. So today, I am hoping that we can have some empowering dialogue and learn from each other, and was so uplifted by Jametta already. Many ask why and how do you do so many things? The why is simply that most of these things are connected. They absolutely are. And they're related to each other in some way or other, and also rooted in ineffective systems and policies. The insight and implementation of sound solutions are contingent upon bringing to the table the lived experience and the voice of those who are most impacted by these very same issues. Those with the authority or connections to make that necessary change that we all know needs to happen, and to make sure that it's implemented properly and tracked for continual changes that need to happen. I suggest that that table should be facilitated by Mr. B. Human and moderated by Mrs. Equality and Respect. There should also be two standard spokespeople that represent and lift up this at every meeting. And their names are Mr. Before the Pandemic and Mrs. Prior to the COVID, to defend themselves and lift up that they did not cause this economic crisis. And most of the inequities have been challenging humanity in some communities for generations. They simply made these disparities more apparent and more widespread. They merely pulled the cover off of what was already happening, and they simply revealed what parents have been fighting for all along, to make sure systems are working well together for our families and communities, always building intentional relationships along the way. We will share how parents have been at the forefront of all innovative change that has happened so far for many years. And we continue through COVID to find creative ways to meet those challenges, to recommend sound solutions and policies and legislation, and we will continue to fight. And so I'm hoping we have a real conversation today. And I talk a lot, so I'm going to turn things over to my amazing prodigy, and also one of the Fab Five. Liliana, take it away.
Thank you, Mrs. Rose. You see, what an exceptional woman. She's been my inspiration to keep doing this kind of work. Well, my journey started about 6 years ago when I have the opportunity for to be trained as a parent leader with a coffee model. And it started just when I needed the most. I came to the US 28 years ago, you know, as an immigrant with no English, with no resources, with no family. It was hard. It was hard. It was a very lonely life and depressing life. You know, with that, my self-esteem was very low. And I had the opportunity to be trained with these amazing leaders that is coffee. And one of the trainings, you know, the main is self, family, and team, which was exactly what I needed. I could tell you more about that, but you know, the core of this is what it got me to the place where I am right now. It's been a journey of 6 years where they taught me how to set goals, how to dream. You know, as a human being, you got dreams, but sometimes, you know, they got delayed within your kids, your family, your responsibilities. But this, one of my goals, you know, was my five-year goal was to do the same thing these amazing ladies were doing with my life, change it completely. And I was seeing myself in 5 years doing, changing lives and inspiring more women to become leaders and to become warriors, you know, of the job that we do. And, you know, I know it was going to be hard, but here I am after 6 years. I'm co-chair with Coffee Power Pack Illinois. Pretty much also leading my branch team from Aurora. And I also, you know, personally, I got to be heard by my school district. I became also the president of the Bilingual Parents Advisory Committee, you know, as an immigrant, and I didn't speak that much English before. it was hard, and I could understand my community, you know, when you don't have the voice because you don't know the language, you don't know where to go, you don't know how to start, you know. That's the main thing. As parents, you know, with no English, sometimes we don't even know where to start, where to go, how to ask for resources. So what coffee has done with my life, you know, it's been inspiring for another. Now I'm a peer parent trainer also, where, you know, my dream that I started 5 years ago to start doing this work and spreading the word with more parents, you know, if that happened with me, it could be possible to do it also with some of the parents. You know, it's like if you know me 6 years ago and you know me now, you could do it also. So the experience that I have through COVID with coffee, it couldn't be you know, less. Myself, I got COVID last year around the summer, around July. And what coffee did for me was giving me all the support. And not only that, but also, you know, it present a platform to support all families that were struggling, because COVID didn't only, you know, hit Americans, right? They hit everybody. So what we're talking about right now, you know, the families that were mostly affected ones were Latinx, African American, indigenous, you know, and I was very sad to see, you know, how this government was approaching those issues, because we have to pay taxes. I'm talking about Latinx, you know, sometimes they don't have a social security. And if you don't have the social security, that means you don't have rights, but you have you don't, I mean, you don't have benefits, but you have rights. You have the rights to pay your taxes, and you're given a number to pay your taxes. But when it comes to receive the benefits from the government, it's like, hello, I'm sorry, you don't qualify. And, you know, on top of this pandemic, you know, families were losing their jobs. Families didn't have access to food, didn't have access to health. And that for me was like the starting point, like we need to do something. And coffee created a platform to advocate for especially those kind of issues, and support the families, you know, within our same network. You know, there were families that didn't have food, they didn't have any income because they lose their job, because they were sick. Myself, I see in the first hand, you know, my husband and I, we were affected. And at that point, we were with no job. And but the bills, you know, were piling. So, you know, at that point, you know, it made us to step up and start working harder. I think this 2020 is when we did the most work, legislative work, you know, like saying like, hey, we need to do some changes. This is unacceptable, you know. And like Mrs. Rose was saying, it wasn't just like the pandemic. That just raised up all the problems that we're being having on the bottom. So, you know, this platform was created to support our families, our low-income families, our, you know, in all the issues that we were working. Like Mrs. Rose mentioned, we have 4 campaigns, and she's the co-chair for one of the Stop the Poverty. There another one that is early learning, where we advocate, you know, for the needs for our children. There's another one for health, food, and resources, you know, where like the families, they shouldn't debate between paying the bills or buying food. So, you know, with this, we would advocate and calling legislators to just to bring everybody on, you know, who has the power to make possible those changes. And what we were doing, just like coffee, you know, like organizing, helping the parents to organize and to talk, you know, because as parents, the families, we have the testimonies, we have the stories, but we just need someone to help us to elevate our voices. And with this, you know, like this kind of work, the framework that you guys are doing, the Beetle Villages, you know, I think it's amazing, because we need more support for parents, for families. we are the ones struggling. We know the issues, but we need help. We need support. We need some guidance, and creating these kind of spaces, elevate those issues. So I think, giving the opportunity to parents to be trained, to learn how to advocate for themselves, how to knowing where to go, where to ask the help, because at the end, everybody should have the right to live a better life and to see it and have better opportunities for our children. And we just dream with that. And I cannot wait for the outcome that will be, after so many agencies partnership in doing this kind of work. Thank you.
Thank you, Liliana and Miss Rose. There's still a little time, Miss Rose, if there were other comments that you wanted to add or other remarks before we open it up to Q&A from the audience. I know we have had a few questions come in, so keep them coming. But Miss Rose, anything you wanted to add before we open up for
Yeah,
questions?
I was busy typing away at some of the questions that were popping in. And I tried to cut it short, so I'm so proud of myself because I talk an awful lot. One of the things that I want to lift up, though, and I wasn't sure whether or not we would get to it when we do the panel portion, is we are meeting parents right where they are in very financially challenged communities, communities with lots of issues around violence or social emotional issues. And so it's not the norm of, hey, come on, parents. Sometimes we have to see that parents are dealing with so much on a daily basis. It's hard for them to see themselves as leaders. It's hard for them to see themselves as someone who could be a part of the change they long for and they want to see and don't know where to start. And I know this firsthand because I'm one of those parents. I was dying from cancer. I had it all over my body, the hospice and everyone said, make me comfortable. But Kofi met me right in that pity party ditch that I had crawled into, and said, while you still have time, there are things that you could even do for your daughters, because that was my greatest fear. And so it's not enough to just say, well, parents don't do anything or parents don't care. We have to understand that there is a leader in everyone, and it is our responsibility to make sure we're providing the support to bring that leadership out. And I'm ready to get into this discussion piece. So
Yeah, awesome. Well, thank you. Thank you both so much. I want to invite Jametta back on camera. We'll make sure to spotlight your video. There are a couple of questions, and I'm gonna start with the questions that are open now, and then I'll also, if we have time, I'll swing back to the others who we've already had an answer for. So the first question, this comes from Leah Sanchez. It says, I believe this is for Jametta. It says, can you share how the Detroit Family Network family health model works?
Sure. So it's based upon the premise that the authenticity, the heart, the lived experiences of community folk are absolutely essential to be part of bridging the health disparities issues between the systems, i.e. the whole health and mental health system, and community. So philosophically, I just want to make sure that that's clear. Community has to be involved in that in a way that is different. And so that's the community health worker model is a nationally recognized approach that trains up people to be a partner with those professionals, that be they in mental health or in primary care health, as well as specialty areas. Well, that's a very wonderful approach, but we know that there's limitations there. It seemed to me that there was another level, and in engaging in the delight with our parent-to-parent work is that we've actually created a first tier, which is the stepping stone into becoming a certified community health worker. So we put we recruit from the community, people who have the heart and the want to do that work. who have experiences that they have always been an advocate. We train them and we put them through almost 40 hours of initial training. We give them opportunities for on-the-job training and coaching. And then we are placing them with organizations, and specifically, as I had mentioned, the Wayne Health COVID 313 mobile units, in which they are working alongside those clinical staff. We stay engaged with them on a coaching level consistently throughout the week. We facilitate professional development, and our goal is that in the first 6 months for those who are part of it, then we will continue that investment and help them become a certified community health worker. And what that does for them is open up other opportunities for economic mobility. But first, I want to say that we train and coach and walk them through this process, and we provide a salary range of anywhere from $14 to $19 an hour to help them in this work. And I would be remiss to say that all of this sounds very nice, but it takes other organizations to help fund this. And so we are really blessed to be able to have a contract, which is part of our model, to contract with entities with Wayne State University, Wayne Health specifically. And we could not do this work without the profound financial investment from the W.K. Kellogg Foundation. And Rhonda, if I may, just give me just a moment. I got to do a screen share, because when you asked about the family health advocacy piece, one of the reasons I was so excited and a little late joining this is because we have just been advised that we have a supportive grant from the McGregor Foundation here to help more parents become not only online literacy coaches in the model and the training that we have, but also become family health coaches, which means that we're going to be battling equity. But also so excited that the W.K. Kellogg Foundation has made a very substantive investment in our work. And so we are really excited about this opportunity.
Yeah, I think if you share screen real quick, there are a few other questions, so I want to make sure
No,
we get
I
to
can
all
pass
those.
on that. Let's
Get to
have
all
conversation.
get to those questions. So there were a couple questions that were answered, and Ms. Rose, I'd love for you to follow up on this if you don't mind sharing a bit out loud. But the question comes from Terry Alves Hunter, and it says, how are you dealing with connecting to the Black community when the faces of the nonprofits are white women? So Ms. Rose, you started an answer, a reply to that. Would love to hear you just share a little bit more.
Yeah, and I didn't get to finish my answer. It's an excellent question. And actually, our executive director, Ellen Schumer, is Caucasian on the outside. But, you know, at the end of the day, whoever is a champion for our people, I personally don't see their color. I see that they're a champion for our people. However, we know the history, and I'm always suspect of everyone and everything. But sometimes people, if given the opportunity, can prove their alliance to you. And some of our greatest allies have been of various backgrounds and cultures. So the predominance of our organization is African American and Latina, but everyone's welcome. We got sprinkles of other dynamics and fathers, granddads. Everyone's welcome, but the predominance is African American and Latina. And I would not be honest if I didn't say parents have to advocate sometimes within and without, but Ellen has a heart based on the things that her mom encountered, that she saw her mom experience as she was coming up and didn't get the accolades or didn't get the credit for the plethora of things that she did. And so from her heart comes this desire to make sure that parents, that's the operative term, are heard, that their voices are raised, that they get the credit, that they get the accolades for all that they do. Because even though our parents are advocating for systems and policy change and legislation up the wazoo, they still have to take care of their moms, their children, their husbands, and everything else that is on their plate. So we're looking at color, but we're not looking at color.
Thank you, Miss Rose. And I want to invite folks to continue to share. We definitely have time for a couple of questions. I think I heard a few things that you all said, and I was jotting down notes quickly. But a question that I have for you as others begin to share some of their questions is what has been the most valuable lesson or valuable thing that you've learned as a community leader, as someone leading and advocating for your community? And maybe Liliana, you can start.
Uh, yes, well, for my point of view, I think it's, like we are very, we have like this organization, it's, for parents. They give us the training, they give us the tools, but pretty much, it's like, what are your needs? They listen to us. And from there, we know we have a whole organization, on our back, supporting us and guiding us. I think, like I feel with coffee that they are my GPS, like guiding me when I don't know how to get to such place. And they giving me the support. And one of the things that for me was has the most value is last year when COVID hit. Like we used to like knocking doors, visit, like we didn't be very active in the community. And when COVID hit, we couldn't do that. And it was kind of like, okay, how do we do it then? Because the community need us, and that kind of like social distancing, and, you cannot come to your neighbors, it was a little bit harder. So what they did also is something like your network, where they got like parent ambassadors,
Mhm.
where I have the blessing and the opportunity to be one of those parents, where like I was making phone calls and see how the parents were doing and what were their needs, if they were struggling something, finding the connection, giving the resources, and still, be active in the community, through a phone, and knowing them, you're not alone. You're not the only one going under that situation, but the whole, the whole system was kind of against us, but at the same time, like we have the right there, the best platform to raise up all those issues that we need help, we need support. We are the families that were the most affected. For example, in my area, right, my zip code, like you were checking the COVID numbers, like my zip code was the highest. And it's like, when the resources were coming, they were not coming to my zip code. So, those kind of issues, like, because I knew the numbers, because I was making the phone calls, I was making the connection with the family. So I knew what's going on in my community. And, I have the opportunity to participate in one of those meetings with my county, with the health department. And I raised that, like, okay, vaccines are getting to the other zip codes where white people. What happened to the resources? Look at the numbers. You are the health department. You know better. So having the opportunity to be in that meeting and raise up this, so they were like, oh, okay, it's someone that is saying something. It's like, yes, I live in this zip code. I went through COVID, so I know we need to do something. Like there's a lot of myths about the COVID that is not real. It's just like a cold. It's like, hey, I could be like, I got it, and I know it's real, and it's not just a cold. So we create something to elevate the COVID and make awareness within our community, because my community was the most affected. So that raising up those issues with the right people, and see you, and I could see their eyes, how they were looking at me, because they knew I was right. So that for me was like the aha moment for everybody. I was just like a homemaker mom, a staying mom, and raising up those issues to these kind of people with the power. It's like, well, you had the power to change that. And so far, if I can tell you, my county, we made up the line that 75% of our population in my county is being vaccinated now. Because the efforts, we organize, we were calling people and, pushing. And, myself, I was participating, in like campaigns, like for the holidays, stay home, please, don't go visit family and, you know, I love you, I want to see you next year, please work together, you know, because that was the only way to work together, you know. Then you don't need to see
Absolutely.
the color, you don't see the culture, you know. It's like COVID hit everybody, and everybody needs to be against COVID. So let's be united. And that for me was, you know, the only time I could see people didn't see your skin color to talk about this issue. So, and
Yeah.
for me, that was precious.
Thank you. Well, it looks like we have time for just one more question. And this question is in the chat box from Diane Wageman. It says, I've been very impressed with your passion, approach, and strategies to empowering people of color. Do you feel that your approach and strategies are replicable in a very rural state where our population is primarily Hispanic and Native American? So this will be our last question. We have about a minute for this. So I'd like to offer Ms. Rose or Jametta, if you will, one of you would like to hop in on this one.
My answer is absolutely. My vision is worldwide. For those who know me, know it's always what I lift up and say. And we have been on that track. So far, Kofi has trained other communities all across this nation now. We've trained other folks as trainers. We've gone to all kinds of communities all across the country. And the key is we are all human beings. We all have gifts and talents. We're not a magic bullet. Kofi just reminds folks and helps them look in the mirror and see how amazing they are. Helps them see that we promote a nevertheless attitude. And I lifted up, you know, my story where I was dying from cancer and it seemed like everything was over. Folks were planning my funeral, and I've outlived some of those folks, by the way. But my story isn't the only one. There are countless folks that I've trained myself that were in such desolate places that now own their own businesses, their own homes, they're trainers, or they're doing other things, or they've moved on to fabulous places and spaces. So yes, because this is the human aspect that of support and relationship building. So absolutely it can be replicated, and we've already been doing it.
I'd just like
Thank
to
you.
add from a best practice standpoint to the audience is that, so you've heard each of us actually have models. So, you know, what we're doing is at the people levels, at the program levels, at the policy level. So we would certainly invite, I feel really comfortable saying this about Kofi and certainly Detroit Parent Network. We are more than happy to have conversations, because it's also issues not only of race, but it's also class. It's also issues of ethnicity and, of course, geography. Those are the things that those of us who believe in equity and who have this opportunity, it's our blessing and it's our opportunity to be here, to use our experiences, our best practices, and what we've learned to push us forward for a more equitable society where all of our children and families can bloom. We'd be happy to partner in that regard.
Thank you so much, Jametta. I want to just extend a special thank you to Jametta, to Miss Rose, to Liliana for joining us, for sharing your wisdom, your light, and just your experience in supporting and connecting and uplifting the leadership that lives and thrives in our communities and spotlighting that. Thank you to our participants who've joined us today. As I mentioned, today's webinar is recorded and our slides will be available at the Now Innovation Forum, which can be found at networksofopportunity.org. I'd also just like to invite you to follow us on social media. You can connect with us via email. We look forward to seeing you soon. Look forward to hearing from you all. Please take a moment to complete the survey that's probably going to pop up on your screen in a moment. Have a great rest of the day, and we'll see you soon. Keep doing the great work that you're doing for children and families. Bye, everybody.
Thank you all.
And thank
Bye.
you now. We need you now. Thank you so much.
Bye.
Bye. Everyone,
Bye.
take care.